Hi, I'm Kasey Boehmer. I'm with the Knowledge and Evaluation Research Unit here at Mayo Clinic. And we're responsible for developing the ICAN Discussion Aid as a discussion aid to support minimally disruptive medicine in practice. I'm here with Dr. Summer Allen here today, who helped us develop the ICAN Discussion Aid and who has also used it in her practice. Summer, can you introduce us a little bit to your practice and your new role here at Mayo?
Be happy to. So I'm a family physician currently here in Rochester, and I recently assumed the role as the Southeastern Minnesota Patient Experience Medical Director.
Great. So you've used ICAN in practice. I would really like to hear a little bit about that experience, what that was like for you, and also what value you feel like that brings to your practice.
The opportunity to use the tool, Kasey, with my patients, it was interesting how it really changed the perspective that I had on the engagement or involvement of my patients. Using the tool, it allowed me with their first couple questions to find out really what was important to them and what they valued. And also, with going through the tool, they were able to focus on what they felt was burdensome to them and maybe what they had under control. And I was at times often surprised at certain things that I thought were more burdensome to them than others.
That's really great. Now, it sounds like you feel like it added value to the care you were able to provide to the patient. We've talked a lot about clinician burnout, particularly in primary care, clinicians feeling like they're stuck when they're managing a lot of chronic conditions for patients. How do you feel like that helped in using ICAN for that?
With the tool, it allows us to focus on factors that I think as clinicians a lot of times we may not fully understand or are unable to properly gather that information from the patients. And a lot of times we'll term these patients as non-compliant or as not wanting to adhere or care about their chronic disease. And in this case, it really changes that focus and allows us to understand where the patient's coming from and what they value, and allows us to develop a plan that the patient's comfortable with and that they feel like they've shared in. So I found value, and I felt when the patient walked out of my visit that they were comfortable with the plan and that it was something that they felt they could follow. Where in other cases and previously, sometimes when the patient walked out, I had no idea if they were going to follow it or not.
That's really great. Now, some clinicians might say, wow, that sounds like a lot of work. Can you talk about really how much time you felt it took, whether you felt it was efficient in your practice?
That's a great question. When you first presented the idea and we were going to utilize it, I thought that it was going to add more time to my visit and that I wouldn't be able to incorporate it. But really, as I became comfortable with the tool, I was easily able to go through that information in less than 5 minutes and allow it to tailor and focus the visit for the patient and I in that conversation that we were going to have about their chronic disease or about their care.
That's really awesome. So part of the reason it is so efficient is because we employed a user-centered design process and really put this into practice rather than developing it in conference rooms. So you got to experience that. You got to sort of walk with us in that journey from the very beginning. Can you talk a little bit to what that experience was like and how you think that makes it more helpful?
I think you just touched on it. This is what allows the tool to be efficient when it's used by clinicians and also beneficial for patients, because it was created by clinicians and by patients for patients. And the ability to iterate on the go with you guys and through each step by feedback that we provided you and the feedback from the patients, again, really allowed it to be tailored to the needs of our patients.
That's awesome. Well, I'm excited that you're finding value in your practice with it. I hope that many are inspired to perhaps pick it up and try it. You can find the ICAN Discussion Aid on our website below. I invite you to take a look at it and to use it in your practice. It's freely available to everyone. Thank you. Thank you, Summer.